Great, thank you. Good evening, all. For those that don't know me, I'm president and founder of MS Views and News, and I'm a multiple sclerosis patient. We would like to welcome all of you to tonight's virtual MS event. Now more than ever, MS Views and News recognizes the need for the MS community to stay connected and engaged. We want you to know that we will continue MS Views Live, as well as other online virtual MS educational events. You can send in your questions, log on live, email us, and stay connected all the time. But like for tonight, there's a question box on the right side of the screen, and you can write your questions in there. And depending on the volume, I'll be able to either read your questions or not, because unfortunately for everybody online, we also received 6 pages of questions today that we had already printed earlier as well. Now, hearing others' concerns and questions help, and your engagement supports our MS community. We are very happy that you are here online with us. And now I would like to introduce Dr. Annette Okai. So Dr. Okai is the founder and medical director of the Multiple Sclerosis Treatment Center of Dallas at Baylor University Medical Center. Dr. Okai is a fellowship trained in MS. She uses a multidisciplinary approach to manage all stages of multiple sclerosis. And before Dr. Okai speaks, again, I want to let you know about that question box on the right side of the screen, and I'll relay them on a first-come, first-served basis as we get to the questions at those various intervals. I'll try to get to as many questions as possible. So the format for tonight is Dr. Okai is going to speak for 10 to 15 minutes, and then she's going to stop, and we're going to take on some questions. And we're going to try to do 5 to 10 minutes of questions at a time, and then she'll speak again for another 10 to 15 minutes, and then we'll get back to the questions again. Okay, and again, as I said, we're going to try to do as many of these as possible, okay? And it doesn't have to be only related to COVID-19. If you have any MS wellness questions that you want to ask, please do ask. Dr. Okai is very qualified to answer any of these questions. So whatever you have, please throw our way. And in the meantime, let's get started. Dr. Okai, it's up to you.
All right. Thank you, Stuart. I want to thank you, first of all, for having me do this program. It is very necessary and needed in this time, which we have put this up. We are in unprecedented times right now, and there are lots of unanswered questions about how we're going to go about trying to navigate the world around us, especially with the new virus that have shown up in the past couple of months. What I'm going to attempt to do today is tell you what we know, what the recommendations are over from the CDC and from the MS foundations worldwide, and then take some questions and try to answer as many as we can, knowing that there isn't a whole lot of data available for MS patients, or for most people, as a matter of fact. There isn't a whole lot of information on this virus as a whole, but I will try to answer as best as I can to my knowledge and what is available to help alleviate some of the questions and the anxiety that you have. So moving on, this is my disclosure slide. And first slide, so what exactly is the coronavirus? The coronavirus is actually a class of virus, but what we are seeing now over the past 2 to 3 months is a new type, a new form of the virus. So this virus have never been seen in humans before. It was only ever in animals, and in late October, early November was the first time it was reported in human beings. So while coronavirus as a class has been around for a long time, this particular strain of the virus is new to humans. And this is very important because if we have not seen this virus in humans before, we do not have any kind of immune system to fight it. So our immune system have to recognize it and then develop a response to this virus. So with it being new in humans, it also limits how to treat. At this time, there isn't any treatment for the virus because this is the first time it has been encountered, and it's going to take a while, just like our immune system, it is going to take a while for researchers to develop any kind of treatment, any kind of vaccination to this virus. What does it do? Right now, we know that the virus attacks the lungs and the airway, so it really affects the respiratory system. Once again, this is what we know about the virus. We do not know any long-term effect, what it does over a period of time, or if it affects any other organ system. But from what we have seen is that it mainly attacks the respiratory system, meaning your lung and your airway. So everyone is susceptible to the virus, but as you know, we will take a common example like the flu. The flu normally affects people who have the young and the elderly and people who are immune compromised. So this virus, what we are seeing is affecting almost everyone, but those more at risk include the elderly. Also, those who are immune compromised is considered a high-risk category by the Center for Disease Control and other infectious disease agencies. So what do I mean by immune compromised or those who are at high risk? So we talk about the elderly, their immune system aren't as strong as most people who are younger than them, so they are at high risk. But also if people have underlying conditions, especially those with lung issues, so people with asthma, people with COPD, people with heart disease also are at high risk for this virus. Immunocompromised patients are patients who have lower immune system, and those patients and MS patients who are on certain medications fall into that category. So most of our medications, not all of them, but most of them, especially the oral pills, the infusions, they lower the immune system of MS patients. And because of that, it lowers the ability to fight off viruses and infection as robustly as someone who has a healthy immune system. And because of that, it is important that special precautions are taken to avoid exposure to this virus. So I'm sure all of you on the program tonight have been inundated with news 24 hours about the virus, updates going on. But the key takeaway from that is that it's important to protect yourself. Prevention is better than cure, as most people will say. What are the common recommendations? So the World Health Organization recommends that you wash your hands with soap and water for at least 20 seconds. Make sure that you get a surface of your hands covered, and that is important in preventing the spread of the disease. Avoid touching your face with hands that haven't been cleaned, because the virus really enters the body through mucous membrane. First, it's droplet. It can enter the body through droplet because you inhale and your mucous membrane then absorbs it. And you have lots of mucous membrane around there. You have your oral cavity, you have your nasal cavity, and you have your orbital cavity, your eyes. So all of those areas are areas where you can introduce the virus. And that's why it's important to avoid touching your face, especially if your hands haven't been cleaned. So soap and water is the best way to keep your hand clean, but you can use alcohol-based rub. The alcohol have to be at least 60% alcohol for it to be effective in combating the virus. It's also important that you keep distances from people who are showing signs that they could be ill. So people who are coughing, sneezing, sniffling, keep at least 6 feet away from them. And more importantly, what the organizations are now recommending is that you try to avoid exposure to other people as much as possible. Stay home as much as you can. Only go out for essentials, essential travel, essential trips to the grocery store, essential if it's important that you go to the doctor's office, make sure it's essential and not just routine. If you are showing signs, you're coughing, sneezing, make sure you cover your mouth, and not just with your hands, but in your elbow or in a tissue, and avoid just sneezing into the air. That's important, and it helps prevent the spread of the infection. Now, that's just general recommendation for anyone out there, for the entire country, actually, in terms of limiting the spread of the virus. I will stop here and ask Stuart if we have any other questions before I move on to MS-specific things from the MS societies.
So we actually do. We have a lot. And but one just intrigued me first coming in online, and the person asked, I'm scheduled for Rituxan in 2 weeks at Washington University in St. Louis, and he just got news that a couple of the doctors just got tested for the virus. Would it hurt him, or he says may, to delay?
To delay the doctor's visit.
Delay getting his or her next infusion.
Okay, so right now, what is being recommended that infusions be delayed unless in extreme circumstances, especially if you have been on the infusion for a period of time. It's okay if it's delayed a month or two. Now, I'm speaking generally, but there are times when, for some people, they cannot delay that. So that's an extenuating circumstance. But for most people, it's okay if you delay the infusion for a short period of time, because it is better to have a little bit of your immune system in place than to be totally immune suppressed from the infusion and trying to combat this. And I'm speaking about infusion generally, but when I go to the next slide, we'll talk about the different types of infusion, and there may be one that you may get without any significant harm to you as opposed to the others. But but for most of the infusions, and I guess I can just go into it right now. When we're talking about ocrelizumab or alemtuzumab, what we are recommending and the MS societies are recommending is that those infusions be delayed. For natalizumab, those patients can get their infusions on time, or with you can even delay that. But the main infusions that we are talking about is ocrelizumab and natalizumab, because those are really, really suppressing the immune system.
So Brent would like to know, he or she, I'm sorry, I don't know which is which these days, but my question is, or this person's question is, that they're having a Tysabri infusion on Monday, and should they be at risk by going to the appointment? In other words, not about having necessarily the medication, but just being there among other people.
So, as I think most infusion centers, and I will hope that most infusion centers are taking the necessary precautions to avoid a whole lot of people being in the infusion room. So, in my center, what we are doing is that we're stacking the infusions, uh, um, minimizing the amount of patients that are in there, so that we don't have 4 to 6 patients all at once, but we have 2 patients, and then bring in the other 2, so they are sitting at least 6 feet apart, and we don't have a whole lot of people in there at the same time. So what I will recommend is that if you have an infusion coming up, is to call the infusion center and say, what steps are you taking? How many people are going to be there? Is there going to be enough space between us to help minimize the risk of exposure? With natalizumab, it's an hour infusion, so it's easy to spread it out, to spread people out and get the infusion done at that time. And that's what I'm doing in my center, is to make sure patients are stacked on one another. They're very 2 at a time for a 6-chair infusion center, 2 at a time, so that we do not have everyone in the same space at the same time and everyone can get their infusion. So just bring them in one after the other instead of all at once.
Great. So I'm going to do one more. Thank you for those answers. I'm going to do one more from people that are online right now, and then I'll go to this list. And Ellen would like to know, she says she's 70 and that she takes care of a couple of children that are 6 and 8 years old. And is there an amount of time that she would need to wait before she can take care of them? And under what circumstances might she be able to take care of them?
Well, so 70 years old. First, that's in a high risk group we talk about, and not to bash kids, but they do have a whole lot of infections. So we're not sure how this is going to play out in the next couple of weeks. Everything is still day to day and is rapidly evolving. So in terms of giving a time frame to say, wow, okay, let's see, wait 14 days before you start taking care of them, I'm not sure if that will be the right answer, because while those kids aren't with her during that time, what are their parents doing? Are their parents still working? Are they going to another daycare? Are they going to, is someone coming to take care of them? What have those, who have they been exposed to while they weren't with her? So all of those questions have to be answered before you can get the clear to go ahead and start taking care of them. If someone has been self-isolated for over 14 days and they haven't seen any signs, then that's a good indication that, there isn't a sign, there isn't an active infection going on. But as I said, until you can account for everyone that have been exposed to the kids and what their exposure have been, it will be prudent to avoid that at this time.
Thank you for that. Jenna would like to know, if we have a compromised immune system, are we likely to show signs quicker than the regular population?
So we don't have enough data on that, whether the signs are going to come quicker than the general population, or if you're going to show signs at all. There isn't enough data to direct us on what MS patients experience with this virus. In fact, as of now, I'm not sure of any MS patients who have contacted the virus or who is being treated, and that's something as MS specialists around the world, we are trying to get as much information as possible. Just the past 2 days, people have tried to put forms together to see if there is a patient, how they respond, how they react, and all of that. So there isn't data about people showing signs earlier, or the virus causing a relapse, or if it's going to be worse in this group or the other. So we'll just have to wait and see. But once again, taking as much precautions to prevent exposure is important.
Okay. Are there any, I don't know the real word for it, but are there any early signs to show that a person, before they actually even are showing symptoms, is there anything that they can determine? Like one person asked me about them having swollen glands, which that person tells me that they always get swollen glands because he's got allergies. So he doesn't know if it's the allergies or that at this point in time.
Exactly. So it's tough to know, right? Because anything can give you swollen gland. You can just have a sniffle and you get swollen gland. You can have strep throat and you get that. So, but I think it's important to notice signs. You know, fever is the main thing. So if you have fever, if you have cough, and any other respiratory symptoms, call your healthcare provider and then see because there's a triage process as to as to determine whether you're having a cold, whether this is allergies, whether this is a strep throat, or whether this is COVID-19. But it's important to know that fever and cough, the combination of that raises the suspicion. It's a high suspicion for that, and that needs to get checked out. And for MS patients, if those combinations are present, then it's really important to get checked out right away.
Great, thank you. A simple question from another person who wants to be anonymous. Hand washing, always spoke about. Should they use hot water, cold water, medium water, hard water, soft water, whatever water?
Whatever water. I mean, I prefer warm water, but whatever water, as long as you wash for 20 seconds and cover all surface of the hand. And make sure that after you wash, when you're closing the tap, you don't use the hand that you have just washed to turn off the faucet. Make sure you have a paper towel right by to turn off the faucet, because that was the faucet, that was the dirty hand you used to open the faucet, and you don't want to use your clean hand to close it. But it doesn't matter, hot, cold, as long as you wash for 20 seconds, cover all surface, and make sure you use a paper towel or something to close the faucet with your clean hands.
Great, thank you. Here's a non-virus related question from Melanie. I have MS and pregnant. What are your recommendations for a healthy pregnancy?
Okay, Melanie, pregnancy. So pregnant women, they Centers for Disease Control, the CDC, also place pregnant women in a high-risk category that people need to be take more precautions. So my recommendation is to avoid large crowds, stay home if you can. If you are working outside of the home, work from home as much as possible. Have friends and family do your grocery shopping for you. Make sure you're eating cooked food. First, continue with all the pregnancy precautions, but also in addition, you limiting social interaction really has been shown to decrease exposure to the virus and eating healthy.
Great. One more question from online, and then I think we should go back to your talk again. Okay. And that is that Jake Davies says that this was recommended by a physician, that would it make sense to take an oral medication while infusions are being delayed?
Well, so here is the issue. With infusions, and most of the infusions that are being delayed, they have a long-term effect on the immune system. So if we look at ocrelizumab, when you do take that, their effect is anywhere from 5 months plus. That's why it's dosed every 6 months. But even past 6 months, sometimes the effect of the drug may last longer. Some people, and for different reasons. Let's say, for an example, if we didn't have this this COVID-19 crisis, take insurance at the beginning of the year when most insurance changed. Most people miss their infusion for a month or two, and they really don't have any untoward side effect from missing that medication. So because, there can be some carryover from the last infusion, so they really don't need to be dosed right away. And that's how you look at this virus situation is, okay, if I don't get it at 6 months, that does not mean at 6 months I'm just going to have a relapse right away. You may get some carryover. Now, the issue with introducing an oral medication, and there's no direction for this. I must put that disclaimer in there. There's no direction. We've never encountered this before, and we're just looking at it from a medical, a scientific standpoint, is that if you're already immunosuppressed from one of these infusions and you go and add an oral therapy, the first thing is most oral therapy takes a while to have a therapeutic effect on the patient. So if patients who are on here know when they start medication, they're on it, and for 6 months, we just monitor because the medication is working up to a therapeutic level in the patient. So if you start an oral medication and your infusion is delayed for 2 months, there's no, I don't see how that will give an added benefit of keeping you covered because you haven't reached a therapeutic threshold. Secondly, with an oral medication, most of them are also immune suppressant. So then you add additional immune suppression on these long-term medication like Ocrevus and alemtuzumab, and then so you are doubly immune suppressed. So I am not sure how adding oral medication for 2 months will provide additional benefit to the patient.
What if things go longer than 2 months?
Well, if things go longer than 2 months, then we have to get creative with how we address these things. Do we give steroids periodically? That's one thing to consider. Are we going to switch therapies completely? There are lots of things that come into this. So for natalizumab, and I'm not sure who's holding that, but we know that if you get off the medication and you're not treated for a long period of time, you can have a rebound effect with that. And in order to prevent that rebound effect, we have to have an effective medication that can do that. And so moving from natalizumab to most of the other orals, and I say most because 1 or 2 have equivocal things, but most of the other orals haven't been shown to control that rebound effect from the medication. So how is that going to go? We don't know. As I said, because this is all new and there's no direction, we're in uncharted territory right now. We really have to take a step back and make plans. Okay, are we making plans for the next month, the next 2 months, or the next 6 months? If someone is on an infusion and we're anticipating they're going to go 6 months plus with a off infusion, that will not, then we have a different strategy compared to someone who's going to be off for a month or 2. And with that, Stuart, my next 2 slides will address that.
Great. Let's see them.
Okay. Okay, so so this slide talks about people who are at high risk for the virus. So those who are immunocompromised, I talk about washing hands, but what about in your home? What do? You also want to practice food safety. You want to cook your food well. You want to make sure things aren't cross-contaminated in terms of your chopping boards and all of that, to help minimize this cross-contamination between the two. Specifically, the CDC also recommend that high-risk group avoid public gatherings and crowds. And I said this before, but I think this is something that is important to really point out as a takeaway message for patients. Try to avoid large crowds, practice social distancing, and if possible, stay at home as much as possible. Avoid using public transport because lots of people can be on there and they can be carrying a whole lot of bugs you don't know. For doctor's visit, and this is a call I've been getting every day for the past week or two. If your healthcare provider offers alternative to in-person visit, make use of that. So people may do telephone visits, people may do video visits. In the recent bill that was passed by the Senate, there were many restrictions on telemedicine prior to this, and they have loosened those restrictions and made it a little bit easier now for neurologists such as me to now conduct visits. So we're trying to get that set up in the clinic, because you don't want to be in a waiting room full of other people that may be sick and carrying some kind of infection or some kind of bug. And especially if you're over 60, especially if you are on one of the medication that causes profound immune suppression, try to avoid face-to-face. If you're just going in for routine follow-up and you need your medication refilled, if it's possible, do a phone visit, do a video link visit, and that will help minimize your exposure. For people who need groceries, everyone has been out and shopping and trying to get as much as possible in their homes. But if you still need grocery, utilize, community sources, utilize family, friends to do your groceries for you, so that you are not in the grocery store, you're not touching the carts, you're not being exposed to everyone who's in there. The next slide, I'm talking about the Multiple Sclerosis International Federation. So a group of experts, MS experts, got together, and this is in specific regards to disease-modifying therapy. What should we do? What are the guidance right now? And once again, realizing that we do not have a whole lot of data, and we do not have a lot of direction how these people with MS respond, but based on our best scientific knowledge, this is what they're recommending. Stay on your current MS medication, on your current disease-modifying therapy. Do not stop until you had a talk with your healthcare provider. As I mentioned before, stopping your medication can lead to relapses. If you're on a medication which lower your lymphocyte count, and I listed them at the bottom of the screen, we're talking about alemtuzumab, ocrelizumab, cladribine, rituximab, fingolimod, siponimod, dimethyl fumarate, teriflunomide. All of these are infusion or oral pills. And you're in a community, and we're all, I think, almost all the states in the U.S. Are now have some cases of coronavirus, except 1 or 2. Isolate as much as possible to reduce the risk of infection. For those who plan to start any new MS therapy, then this is the opportunity. Do we start one of these medications, or do we start something else? So the injectables, are not immune suppressive, do we start with that? What we're recommending is that people hold off on starting these medications that can lower your lymphocyte count until we have a better understanding of what the virus does and how long it's going to last, how long this pandemic is going to last. So if you are already on a medication that lower your lymphocyte count, your doctor, your healthcare provider will monitor you and put guardrails in place to help, one, treat you safely, and then make sure that you're still treated effectively. So as a doctor, the first thing we're taught is do no harm. So we don't want to just go ahead and continue your infusion or start a therapy when we know it can put you at risk for this infection in this time that we're in. But if you're already on there, what adjustments can we make? What modification can we make that you are kept safe and that also you are treated properly so that you do not have a relapse while we are trying to figure this out? So any further questions, Stuart?
Absolutely. So one of them is, and it's a little bit long, but a person wrote, I have struggled with depression throughout my battle with multiple sclerosis. Being isolated at home because of COVID has not helped. Do you have any recommendations?
So yes, being isolated is it has an effect on the mood. That is one thing. So I mean, there's only so much on TV you can watch, and binge watching on Netflix. I mean, there's only so much you can do. Take the time to connect with family members and talk on the phone. Take the time to just reach out to other people, knowing that you cannot go out. The phone is your friend if you have video capabilities, FaceTime, GChat, WhatsApp. All of those are available. And connect with people, connect with your peers, connect with other people living with MS, and try to keep your spirits up that way. Because if you can, make sure all your windows are open. Let the sunlight in. Step outside your door, but that's where you are. Make sure you're once again not in a gathering. But if you can step out and take a walk down the block and back, that's fine. It's not just lingering in the air. It's if someone's carrying it and it's there and you have sneeze and something, it happens. So you can still do that, but don't do it when there are lots of people outside or people are jogging, running, or you live in a dense area where everyone will be there at the same time. But take this time to connect, use your tools as much as possible, and that's the best we can do at this time. But really, it does have an effect on the mood, but being safe is important at this time.
Sure. Thank you. Also, our organization, MS Fusion News, will be providing more and more virtual programs. We're going to do it with different things like maybe yoga or physical therapy, some sorts, or just maybe get a person
on a channel. Yeah.
Maybe even getting a comedian on here. That we know people with MS that are comedians, and we could have somebody come in and do this too. But we're not the only organization.
That would be a great idea.
Thank you. We're not the only organization doing these things now. We're all the different MS organizations. Those that are part of the MS Coalition are going to be trying to do whatever we can do to help out the patients the patients and their families that are now stuck in their homes. So I just wanted to say that as we go forward. Next question is, a person needs to go in for blood work for JCV antibody stuff, and he has to go to Quest. And he's not happy about having to go to Quest. With all these other ill people there now. So what does that person do?
So what I am recommending for my patients for non-essential blood work to postpone that. You know, the JC virus is a screening tool, and yes, we recommend it checking it every 6 months, but it's okay if it's checked 7 months or 8 months. If you don't have to go in there, because that's, you know, it's one of the sites that they are doing COVID-19 testing. So I am telling my patients to just hold off on getting the lab done if they're going to Quest. That it, you know, unless, you know, there's something that needs to be monitored weekly, there's no need to go in and be exposed in this type of situation instead of waiting for a month or two. Yes, I am advising patients to hold off on labs at especially where you have to go in and you don't know who's been there before, who's coming after, who's gonna be in there. It's okay to hold off for a few.
Okay. Person wants to know if there's any food that they can eat to help them stay healthier.
Oh, great! They were reading my mind, because on the last slide I'm going to talk about just general wellness, what you can do to help help you remain healthy during this time.
All right, then we'll hold off on that one. Stacy says that most schools have let out for an extended amount of weeks, adding up to maybe 4-week time frame. What can parents do to help them cope with this?
Oh my goodness! So cope with the kids being at home?
I don't know. She ended very quickly here, so.
Yeah, that is that's tough. As a doctor, I don't have a prescription for that, but
I cut it off. I'm sorry, I missed out on the rest of this. So what can parents do? Part of my screen is blocking it. So what can parents do to block themselves from possibly catching something or being exposed to the children that may have already been exposed? So the kids who may have already been exposed by not showing it, how do they protect themselves?
Well, until, you know, if they're not showing it, we don't know, right? But if there are others in the house that can help with child care, that can take on most of the responsibility of taking care of the kid until you know the 14-day period have passed, that is something that I will recommend. You get as much help as possible. For some people, you know, they have extended families that will take care of the children for a few weeks and make sure that there are no signs of any kind of infection or exposure. So I would say utilize all your resources. It's tough if you have kids to say, you know, trying to isolate or not be hands-on with them. But if you have a strong suspicion that, you know, after home from school and you think that they have still been exposed, then those are what the measures I would recommend.
Okay. Another person wrote, my husband's an electrician and he must go to work, unfortunately. He cannot work from home. However, he's taken every precaution he can to remain away from other employees at work. He's also wearing a hazmat suit, gloves, mask, etc., and wiping down all of his equipment, knowing that if he brings the virus into our home, he could ultimately kill me with MS and being on Rituxan. What other precautions can you suggest, be it that he must leave our home and put himself in danger? I'm needless to say a wreck over this, but he must support our family.
Exactly, and that's a tough situation because someone has to work and they have no capability to work from home. Once again, what I recommend is so for the husband, take all the precautions while he's up there. She's saying he's wearing a hazmat suit. That is a good thing, but when he gets home, the suit remains in the garage or it doesn't come in the house. it stays, so designate an area where this is a no-go zone. This is where work clothes remain, and this is where your home clothes and what you're wearing is here. Make sure they practice as much precautions as they can, hand washing, sanitizing, cleaning the surfaces around the home every day if needed. But I think the main thing, if he has to be out there, is designate an area where you separate work from home clothing, and it stays there, and that's how it is. And so to avoid exposure as much as possible. But you know, he has to work, so that's what needs to be done.
All right, thank you for that. Talia writes, my husband was exposed to COVID-19. What should I be looking for to see if he brought it home? If I've been exposed, is there any special need I have to do with me having MS?
So there has been exposure. Is he being monitored? Is she being monitored? So if there's suspected exposure, what they recommend is continue to take your temperature, measure, monitor for signs and symptoms, including coughing, sneezing, runny nose, and all of that. And then if that is the case, to call the for, I don't know what it is around the nation, but for most primary care doctors, they have a hotline instead of going in that or do e-visits where you go and they triage, they ask all these questions and assess the risk for the virus. And then I'm not sure about the testing part, if that is available all over. In Texas, in Dallas specifically, the county also have a number, a specific number you call if you suspect exposure, and then they go through the different steps and processes on what to do to make sure of that. But if this person is at home, you know, once again, try to clean all the surfaces, make sure whatever they were wearing not in there anymore, and observe the 14-day period and see what comes from there.
Okay, great, thank you. Next person writes, is it safe to go for walks in the park or on the beach as long as you keep the proper distance? I think you answered that before, so if you can be brief, that would be great.
Yeah, walks in the parks, depending on how many people are in the park or on the beach. You know, solitary walks are great, but if there's a beach full of people or a park full of people, then you want to avoid that. But, and if you're in the park, don't touch, you know, whatever benches and whatever, but go at a time when there aren't a whole lot of people out, and minimize touching or whatever else is around there.
Right. So again, more people are asking about, you know, their risks, or which of the different types of medications for MS and which puts them at higher risk. I know you mentioned it before. I do want to let everybody know that on the MS News and News website, in the center of the page, near to the top, there is a listing from the CDC, as well as the MS-CIF, which is the Multiple Sclerosis International Federation, which gives a list of all these different things that can affect you or not. So if you know, you could hear it here, or you could go there as well. But Dr. Okai, I'll let you answer that if you wish.
Yeah, so on the screen and the slide before that, I mentioned alemtuzumab, ocrelizumab, cladribine, rituximab. Those are infusible in one oral therapy. Those make people who are on those medications, make them immunocompromised and put them at higher risk for the virus. But also in terms of the oral medication, fingolimod, simpolimod, dimethylfumarate, monomethylfumarate, teriflunomide, all of those medications also causes lymphopenia, low lymphocyte counts that can affect a person's ability to have a robust response when they encounter an infection. For those on the oral therapy, once more, the MSIF recommends that you continue the therapy and do not stop on your own unless explicitly told by your healthcare provider. There are some other reasons for that to happen. If you're on one of the infusible therapies or you're on cladribine, the infusible, most especially alemtuzumab, ocrelizumab, and rituximab. Natalizumab is not included in here because at this time we don't think that it needs to be held given what we know about the mechanism of action. But any other infusible therapy and then cladribine, talk to your healthcare provider about postponing the second dose or further treatments if necessary, and then just monitor and take it, a week at a time. All of this is evolving so quickly that, concrete answers are hard to come by. And we do not have full information on how things are going to pan out. So we are adapting as we go along and to help provide our patients to keep them safe, but also make sure that they are in a place where we're not putting them at higher risk for relapses.
Thank you. Sandy would like to know if he could go to the dentist.
So the dentist, I will hold off on the dental appointment for now and just postpone it because once again, your oral cavity, mucous membranes, someone is right in your face. Yeah, I will recommend holding off on non-essentials procedure at this time.
Okay, Jessica writes, I work in healthcare and have direct contact with, and have had direct I work in healthcare and have direct contact with us. Just had an Ocrevus on 123.20. Should I still be working?
So it all depends on what part of healthcare you're working in. If you're in a hospital situation, could you take some time off? If you are in a situation where patient contact isn't a major part of your job and you're just in a different division, that's something that has to be considered as well. Healthcare is difficult to work from home. I wish I could work from home all the time too with this going on. But for most people who do not feel comfortable, especially if there's a lot of patient interaction, then it's best to see if you can take some time off and just try to avoid interaction with a whole lot of sick people that can affect you. But all of that depends on the job description.
Thank you. Patricia would like to know if she's supposed to be going away sometime in the next 2 weeks to another city, staying in hotels, attending amusement parks. Most of them are closed right now, Patricia.
Yes.
Parks, eating out, etc. Is this something to reconsider and cancel plans?
I would strongly encourage her to reconsider that because first, cities, you're moving from one city to another. The risk of exposure is high. You're staying in a hotel room. That poses another risk. And then I'm not sure what's going on around the rest of the country, but here in North Texas, in Dallas, most restaurants and bars have been closed. So to avoid large crowds and practice social distancing. So New York is also a huge metropolitan city that has adopted that as well. It has been what we know from other countries that have gone through this, and we have seen this come through. We've seen it come from China, going through Europe, and now in the U.S. So we have tracked this over time. We saw this coming this way, and what we have learned, lessons learned from other countries, that if you practice social distancing, this lowers the risk of exposure to the virus. So I'm really not recommending any travel, essential or non-essential at this time, because most people are going to be practicing the same thing. Most cities in the U.S. are going that route. So yes, reconsider travel as much as possible.
Great. One more, and then we'll let you go back. And Angie would like to know, if a vaccine or when a vaccine becomes available, how do we know if it's going to be safe for MS patients?
Well, the vaccine has to be tested in a large group of people before it can be rolled out to the general public. So that is the first thing. So vaccines are tested in healthy individuals, and then based on the results, then they bring it to vaccines are for people who are healthy anyway, by the way, not sick people. But I mean, one rule of thumb that we know is that for MS patients, we do not recommend live vaccines. So it depends on the component of the vaccine. If that vaccine is a live vaccine, then we will have reservations about recommending it for MS. But with any live vaccine, we have to weigh the risk and the benefits. If it is providing more benefits and people need it, then we will have to say, okay, this is what you need. It has to be on a case-by-case basis. If it's not a live vaccine, if it's an attenuated vaccine, most MS patients can take attenuated vaccines. So that is one way to know if it's safe for MS patient. The first question is it a live vaccine or is it a killed vaccine? A killed vaccine, usually MS patients can get that without any serious consequences. Live vaccines, MS patients have, we do not recommend that for MS patients. But if you're in a situation where it has to be given, then it's given. But that's on a case-by-case basis.
Thank you for that. For those that see me touching my face, I have sanitizer to go with it too, all right? So while the doctor's talking and I go blank, I'm using my sanitizer, all right? Anyway, let's let Dr. Okai continue now.
Okay, so I am going to finish up talking about the healthy lifestyle, what you can do to keep healthy during this time. The first thing I mentioned that this virus was that it affects the airway, so the lungs and the rest of the respiratory system. So if you're a smoker, we really encourage you to quit smoking. It's easier said than done, and it's hard when you've been smoking for a long time, but there are aids out there to help you, because smoking not only affects the lungs, but has also been shown that in MS patients can prolong relapses, severe relapses, and overall just make MS symptoms worse. So consider quitting smoking if you're a smoker. That helps significantly in helping your symptoms. Limit alcohol consumption. So yes, you can have a drink, but not multiple drinks, and well, not binge drinking and not drinking every day, but limit the alcohol consumption. Now, here's the question: eat a well-balanced diet. What do I mean by that? So, well-balanced. First, you want to have fresh things. So, fresh fruits, fresh vegetables. Make sure what you're eating in terms of meats and everything is fresh. You want to avoid processed foods. Processed foods is processed food provides a whole lot of artificial preservatives that can have an effect on the overall inflammatory state of the body. So you want to avoid that. You want to decrease your intake of animal-based protein and eat more plant-based protein. with fish being the exception because we know fish have the omega fatty acids, but mainly starting with healthy fresh fruits and vegetables, less animal protein, less dairy, and more fish protein. That is a well-balanced diet. I normally recommend to my patients that they follow the Mediterranean way of eating because that has been proven through all chronic diseases and even for healthy individuals as the best diet that provides a healthy lifestyle for most, a healthy eating habit for most people, and it's very easy to follow as opposed to some diets which are very restrictive. So the Mediterranean diet can be found on the Health and Human Services website. It employs a whole lot of grains and, as I said, fresh fruits, vegetables, and all of that. So if you're looking for a place to start in terms of improving eating habits, that is where I will direct you. And it's, as I said, it's easy on your pocket compared to other diets, and it's not as restrictive. And once you start that way, you will be as close to healthy eating as possible as most of the other diets, because most of the other diets out there, the core of those diets are around fresh, healthy eating, fresh, healthy, fresh vegetable, fresh fruits, healthy grains, healthy oils, healthy fats. It all centers around there and then expand from that. So if you're looking to make a lifestyle change in how you eat, avoid the high fatty foods, the processed foods, the Mediterranean way of eating is the best way to get started. Then in addition to that, you also want to practice appropriate physical activity. And I say appropriate because for MS patients, there are all levels of ability. But for all levels of ability, there's something that you can do. There are people who can exercise for an hour a day, but there are people who can only exercise for 5 to 10 minutes a day. But the idea is to incorporate some type of physical activity into your lifestyle. And what is a good amount? Most doctors recommend that you get your heart rate up 30 minutes a day, 3 times a week. So whatever you're doing, your heart rate it have to be up 30 minutes a day, 3 times a week, and that constitute a physical activity where to start. So lots of things. Stuart mentioned that on the MS News and Views website, there are videos where you can also look at the different physical activity that you can work along with. And also most of the other MS organizations have some kind of guidance on what to do in terms of getting your heart rate up and how to do it. But at least 3 times a week, 30 minutes during that time is the basic that is required for that. Another question I get asked frequently, how much vitamin D should I be taking? What's the amount of vitamin D? Well, vitamin D, why vitamin D? First of all, vitamin D is important for MS because it's actually a vitamin that helps the immune system, or works on the immune system. So is the vitamin that most of the research has been done in MS, and we have data to really help back why we are recommending it. We know that when people are vitamin D deficient, their relapses may be more severe and may last longer. Low vitamin D increases the risk of MS. So it has been directly correlated with MS symptoms and MS pathology. Most labs have different values of vitamin D, but what I normally do, and most doctors, is that they check your vitamin D level. If you are vitamin D deficient, I normally start off with prescription strength vitamin D, and then once you're in the normal range, I recommend going to the daily over-the-counter vitamin D, and for MS patients, anywhere from 2,000 units to 5,000 units daily is sufficient to keep them in the normal range once they have reached that part. So if you aren't taking it, I will recommend you start taking, as I said, some stores sell it in 2,000 units, other stores sell 1,000, other stores sell 5,000, but anywhere, as long as you're taking a daily supplement of 2,000 units and above, that is a good amount to get started with as well. So with that, I will stop there and take questions.
I'm trying to get back on.
All right, Stuart, there you are.
How about that? I don't want people to see me and be distracted by all the things I'm doing and moving around and looking at the notes and whatnot while you're talking. So the next question, and this is a good one to ask. We've always been told not to take vitamin C and other things that will boost the immune system. But at a time like this, is there an exception to this? And should we take some vitamin C supplementation?
So I am not aware of vitamin C being a banned substance for MS. So vitamin C is a vitamin. Yes, it helps the immune system, but most of the fruits, vegetables, and everything you have vitamin C. So vitamin C is okay to take. There are lots of other supplements out there that claim to boost the immune system, and I'm doing air quotes for those of you who can't see. Now, those are the things that we recommend against because, yes, it's not, we don't want to boost your immune system because it's contradictory to what we're doing with your medication. But most vitamins are okay for you to take. Vitamin C is okay for an MS patient to take. But any other thing out there that claim to help the immune system, echinacea, we don't recommend that. Or any other supplement. So there's a difference between supplements. That's in a different category, and then vitamins are in, I put it in a different category, but overall you need vitamins for your daily health, and that's okay to take. So vitamin C for an MS patient is okay to take, but other extracts, I mentioned echinacea or St. John's or whatever, those are the things we do not recommend for MS patients.
Okay, so again, of course, there's, we have lots and lots and lots of questions from people that are on Ocrevus, some who are claiming that they are very, very healthy and that they never get ill, and they're wondering, even with being very healthy, can they take their infusion? And if their doctor says that he or she prefers not, they're asking if they can go somewhere else to get it. So there's a lot to go on with this. Okay, thank you. There's a person that said, Richard, he's JC positive, wants to know if there's any suggestions for his health being JC positive.
No, there is no specific recommendations or specific precautions just because of being JC virus positive. The underlying thing is MS. And we take the same precautions whether for MS patients, whether you're JC virus positive or JC virus negative when it comes to COVID-19. At this time, that's all we know.
Okay, so at this point in time, I think that everybody should be or have gotten their answers from most of these questions. And I'm going to say, let's say, hey, we had a great night. Let's get this all put together, and I'm hoping that everybody was here. First off, Doctor, I want to thank you for being on. I mean, we've been on for an hour and 10 minutes already, right? It's been a long night, and I think that this was awesome. All right, I want to let people know that looking forward, we look forward to having many MS specialists join us on the MS Views Live event that we're doing now. this is MS Views Live. We have MS Views Now. We have MS Neuro TV. We have a lot of different ways that we provide information for the MS community. And so we want you all to stay tuned and registered. When you see the next event or a virtual event, you could go to our website. You can see what's from there, learn more. Stay safe, everybody. We want you to be involved. We want you to be able to communicate with others. Surely, if you're on Facebook, you know how to do chat sessions. If you're a Twitter person, get on there. If you're an Instagram person, get on there. Stay connected with your communities. Stay engaged. You could visit us also. We're on Twitter. We're on Facebook. We're on Instagram. We're on LinkedIn. So a lot of people that are in the business world do also know about LinkedIn. Remember, you need to stay connected with your peers. The best place to do this, as I just mentioned, is on social media. One more thing that I want to say, it's good English, right? I want to let you all know that everybody's shopping from home these days. Almost everybody is on Amazon, all right? And we have our charity, our organization is a charity, and we're connected through the SmilesAmazon.com. So if you have never used that, it is Amazon. So go to smile.amazon.com. All right, it's going to ask you for a charity name. We hope that you put in MS Views and News. All right, and what this does is Amazon makes a donation to the organization from a portion of everything that you do purchase from them. All right, and what we are going to do with that is we're going to fund our virtual events. So, we do need everybody to help out with this. We cannot just get our dollars to do this from the pharmaceutical industry. We do need to reach out to the outside to do this. And one more thing. So on March 28th, we're going to be doing our last big program for MS March Awareness Month. And we have our MS Summit. We were supposed to be doing this also as a live event in South Florida, but now we're going to do this as a virtual event. And on there, we're going to have two pretty well-known speakers. In addition, well, Dr. Okai won't be on that one, but in a future one, she'll be back. All right. But on this one, we're going to have Dr. Mary Hughes from South Carolina. She's in the Greensville, Spartanburg area, and she'll be on. And she's going to be doing a roundtable with Dr. Aaron Boster. All right. So we've given them a lot of questions. They've already got the agenda. They're going to speak with each other. And then like every 10 minutes, we're going to welcome, the audience to ask their questions as well. So that's an event that we're going to be posting to our website, to social media, probably as early as tomorrow. And we do hope that you can get registered for that as well. It will be a morning, early afternoon event. And again, where are we all going to be? We're going to be home. So you might as well go on there and watch it, right? Okay,
yeah,
great.
Exactly. Thank you, Stuart.
It'll give you something to do. So Dr. Okai, again, thank you. Namaste.
Thank you.
Let's all stay safe. Everybody, remember, wash your hands, use hand sanitizer, okay?
Yeah.
And let's keep on going with this, okay?
And as we get more information, we will try to get it out to them. But for right now, we'll just follow these preliminary guidelines and make sure that everyone is safe and treated well.
Great. Thank you very much.
Okay.
Everybody be safe.
Thank you.
Thank you. Bye-bye.
Bye.